And we have Dr. Mwende in the building once again. It is lovely, lovely, lovely having you on the show. Karibu sana.
Thank you so much, Mikali.
Unatusaidia.
Yes. So,
Sana.
my name is Dr. Mwende. I'm a dentist by profession. And today we're going to talk about oral health, just as we've been doing for the last 2 weeks. And the reason why we're emphasizing on oral health is because the mouth is the pathway to your body. So once you take care of your mouth, you're actually taking care of your body. Once you take care of your teeth, you're taking care of your smile, you're taking care of your look. And it shows that you're actually appreciating your whole body. So that is why we're emphasizing on oral health. Yes.
That is so true.
Yes.
And when you talked about, what you just said right now just made me visualize even the things that we eat, because it is through the mouth that we will misbehave. It is through the mouth that we'll take care of ourselves as well.
Yes.
So what you put in, when you put away all the sweet little things that we eat, tunapata cavities. When you start eating healthy, then it's already oral health.
Yes.
Because you're taking care of your teeth. So we've been on this journey for a bit now, and your questions, please send them in, because that is why Dr. Mwende is here to just answer your questions. We have so many from last week, so we're going to start with those ones as you send in fresh new ones right now. 111 that is our SMS line. It's just going to cost you a shilling to do that. Let's take care of our teeth, mouth, our oral health in general. The mkamba in me just popped. Memskia.
Yes.
Okay, let's start. Hi Mwikali, I am Brian. Ask Daktari what's noticeable, the depth variance. What's noticeable, the depth variance for cavity refill? I think maybe the question is, how deep should it be for a cavity refill?
Okay. Cavities, it starts from the upper part of the tooth, and then it starts going down. That's why I think it's asking about how deep, as in when do you feel. So we usually start feeling cavities once they are very small, because once they're in the upper part of the tooth, that is the enamel, you may not have any symptoms, but actually there is a cavity, because we say that the enamel is not it's not a living part of the body. But then once it progresses down to the inner part, which we call the dentine, you may actually start getting some symptoms, which might be sensitivity or some mild pain. So when you come to the dentist and then they tell you that your tooth has a cavity, and then you're like, no, Daktari, I don't feel anything, so why are we feeling? It's because at that time it's just at the upper part. Okay. And actually that is the best time to start feeling the cavity, because once it starts going down, it means that it's getting very close now to your nerves. So the treatment might actually change. So from as little as once it has started forming, that is when you start feeling the teeth.
Okay.
Yes.
Okay. And if I remember from our previous class,
Okay.
enamel is harder than the bone.
Yes, it is very hard.
The hardest part of the body.
Yes.
Okay.
Yeah.
My baby is turning 9 months today, and she hasn't started teething. Is it normal? And what causes delayed teething in babies?
Oh, that is actually very interesting. We usually give a range for teething from the age of as early as 5 months. You should actually be able to start noticing the milk teeth. They usually start with the lower, and then we go to the upper. So there is usually a sequence. But what happens with some children, or even some there's usually some genetic variation. You may find that white kids, they probably come earlier, Caucasians, they come later, blacks, they come earlier. Like those variations are there. So we usually don't give like an exact time frame when teeth should actually start. But what we call delayed eruption is something that is actually noticeable. Like from the age of like 1 year, 3 months, 1 year to 6 months, and your child has not yet started teething, that is actually a wide range. Because from the age of 5 months, we should start seeing. But at the age of 1 year, 6 months, it means like now that is actually delayed. So from the age of around 18 months and you've not started noticing any teeth, now that is when you get a worry.
Okay.
But 9 months, it's still too early. What will cause some of the delays in eruptions is probably things to do with just nutrition. Maybe if your child was born underweight, they are likely to just develop, generally, they are likely to develop just slower. So you may notice some delays in eruptions, or if there is a problem with nutrition, vitamins and minerals, you may notice that. But once we, at that age, at the age of 9 months, we wouldn't like really say that your child is late for eruptions. Yes. Yeah, so if that baby is healthy and everything is doing well, they are developing well, we wouldn't like say that that is delayed. Yes.
So 9 months, you're still safe.
You're still in the good range.
Okay. Yeah. Hi, ni Karo from Naiberi. Jino inauma sana na kuna kahol pia. Kuna smell, imagine. 3 years ago, nimetoa mbili. Mtapata dawa na ni gani?
Oh, so she's saying about bad smell and there is a hole. So what happens once the cavity, the hole is a cavity or just decay dental caries. So what happens when you have that cavity and it is not filled? Now the food that you eat, it just starts seeping in, like going in. Then that food with bacteria, now it starts decaying and then you start getting that kind of bad smell. So that is how she's having the bad smell, because most people with bad smell will either find that they have hidden cavities that they don't know about, or they have gum disease, or even the worst of the cases, they have something to do with their just GIT, stomach and all that, or issues to do with your sinuses. But most of the time you'll find that patient has a cavity or untreated gum disease. So with that kind of decay, now you start getting that that bad smell. And then if it's not treated now, and then you ignore for long, so when you go later into the dentist and it's a bit, the tooth has just decayed so much, now you end up losing the tooth. So that is how you end up with tooth loss and all that. So the best option, the first thing that we usually do when you come to the dentist, we do the cleaning, and then we start assessing the cavity, how deep it is, and to give the best treatment. Yes.
See your doctor, I think, ASAP.
You need to see a dentist.
Yeah, a dentist ASAP. Hi, Doc Mwende. Is it possible for a child under 18 kuoshwa meno from Nihope from Nakuru?
You mean 18 months or 18 years? But I think it's 18 years.
18 years.
So actually, in terms of cleaning the teeth, you should start immediately after birth. That is when you start, you need to start taking care of your teeth in terms of cleaning. So once you give birth at the hospital, you sometimes you get those wet cotton or that just gauze or cotton, and then you're told to just wet it, and then immediately after breastfeeding, you wipe the gum of the child, because that is how you start taking care of the mouth early, because we don't want that breast milk and just staying in the mouth for so long, because now with that kind of habit, you will you will start neglecting your teeth. So from the time of birth, we actually say start taking care of your child's mouth. At the age of 6 months, or rather when the first teeth start popping out, now you start getting a toothbrush for your child. Just take a small one to just brush the two teeth. If you're not getting the toothbrush, again, get a wet cloth and just wipe the two teeth. Then once the child is now growing around the age of, some kids mature early, 2 years, 3 years, and the child is able to actually come to the dentist and follow instructions, you come and bring them for the simple cleaning. I said earlier that we just use some little paste and a powder and a rotating brush just to clean out the dirt that is actually loosely attached to the teeth. For some kids, you may even find some staining, just some dark staining. We clean that out. So that, the way she's saying 18 years, it is very okay. Because some children will even start developing gum disease very early. Yeah, so it is actually good to get that habit of just frequently visiting the dentist and getting your teeth cleaned. There is no age limit, in short.
Okay.
Yes.
Okay.
Yes.
We're going to take a very short commercial break. I hope you are learning as we are in Darasa. So we now know that you can start cleaning your baby's mouth immediately you give birth to them.
Yeah.
And that is allowed for you to do that. So we're going to take a very short commercial break. Please send in your questions. 111 That is our SMS line. We will get back after this break with Dr. Mwende. Welcome back to Full Circle with Brikali. A very good morning to you. We have Dr. Mwenda in the building. We're talking about your oral health. What are you doing about it? Do you have issues in your mouth, your gum, your teeth? Send those questions 111 That is our SMS line, and the Daktari will be answering them for you. So, kuna mwingine anasema hapa, hi Daktari, my baby is 1 year 5 months. Her front teeth are rotten and swollen. I've gone to the dentist, but no change. What is wrong?
Okay, let me first address the issue of the decay.
Okay.
Because she has a decay, and at the age of 1 year 5 months, we usually grade the kind of decay for children, because once at that age, really, we usually call it early childhood caries, because it's basically in children, and that child is below 6 years. So it's something that is actually a concern. And the reason why we take care of milk teeth first is for feeding. So we need your child to be able to feed well, so that they're able to grow. You know,
Yes.
At that age is when your child is actually growing. So the reason why the dentist will insist on taking care of those teeth is because the child needs that for feeding. So once you start noticing cavities at that age, as a parent, you should get concerned, because if your child is in pain, they'll not be able to feed well, and that will definitely affect their development. So at that age, 1 year 5 months, it's too early. I would say it's too early, because what really happens, this kind of caries, we call it bottle feeding caries, because it comes about because of breastfeeding and also the pacifiers for feeding. So the first thing that I like to talk about is breastfeeding mothers. Please do not breastfeed your child at night when you're asleep. If your baby wants to breastfeed and it's at night, you have to wake up, hold the baby, and
Breastfeed.
Yes.
Okay.
Once the baby is done with breastfeeding, then now you can
Sleep.
clean the mouth.
Oh, clean the mouth.
And
Yes.
sleep.
Yeah.
Because if you let the baby, if you sleep and the baby is breastfeeding, once they are done, the milk will stay in the mouth for long, and you know it's sugary, so it's going to cause, like, over time, your teeth to start, the child's teeth to start decaying.
Okay.
So that is something that mothers need to know. Don't just let your child sleep, breastfeed, and you're asleep. The other thing is the pacifiers, or just the bottles for feeding. Once the child is done with feeding, please clean the mouth again, because at the age of 1 year 5 months, that's too early for decay. And then it's a bit advanced, because she's now saying there is swelling.
Yes.
If I've gotten it right.
Yes.
So it means the teeth have actually decayed, and the decay has gone now kabisa inside the tooth.
Okay.
So now that the child is actually starting to get infection from that, and now the infection, it actually manifests through the gum.
Okay.
As we call it pus. Most of the time you'll find that it is pus. Now the thing is, at this age, the child is not likely to cooperate with a general dentist. So we have specialists for children. We call them pediatric dentists.
Okay.
So this child at that age, if I've gotten, is it the front teeth or the back teeth?
Front teeth.
The front teeth. So the thing with the front teeth, I wouldn't say they're not as important. They are really important, but the front teeth don't affect much the development of the permanent teeth. if they were the back teeth, I would be really worried, because the back teeth for the child, they are supposed to stay there until the child is around 9-10 years. If they are removed early, the permanent ones, they tend to lose direction, because the milk teeth actually guide the permanent ones into occlusion. So if you end up removing the back ones at this age, you're creating trouble for your child in future.
Okay.
But the front ones don't affect that as much. Okay. However,
yes,
since we say the first teeth come out at the age of 5, 6, years, and this child is just 1 year, if these teeth are removed at that age, it means your child will stay mapengo for all that duration, and they may not like it very much, or even you as the parent, you may not like that much. They may even be bullied or mocked in school, because it is too early for that child to stay toothless.
Okay.
So what we do now, because this child, I've said, they may not likely cooperate at the clinic. Now you have to visit a pediatric dentist, a dentist who is more specialized with children. There's a lot of treatment options. Most of the time, the child will either be sedated, we call just to lower their consciousness a little bit, or other times they can be done in theater. What happens that treatment needs to be done, it's just a special kind of fillings done for kids. It's like a simplified root canal for children. We need to treat that infection, and then we need to reshape the teeth, because I think the teeth are probably broken down. They need to be reshaped back with what you call pediatric teeth crowns. There is a special. But then you come to realize, now, if the teeth are kabisa broken, now the child will just have to lose the teeth.
Okay.
There are replacements for children, dentures, but it's too early.
Yes.
We try to make them a little bit beautiful, just to look good. But you see, now at this age, you're really subjecting your child to a lot of treatment which could have been avoided.
So don't feed your children while you're sleeping.
Yes.
And if you're using the pacifier bottles, do not let them use them for long without cleaning them as well.
Yes.
Okay.
Yes, yeah.
I hope you've gotten that, and you need to visit
a
doctor,
visit the dentist,
a pediatric dentist.
Yes.
Hi, Mukali, I'm loving the show. How about when you're brushing your teeth well, nabado unapatwa na bad breath?
I've said bad breath can be caused by lots of things. The first thing that we usually suspect are cavities. There might be cavities that are in between your teeth or are hidden. The other thing is gum disease that has already set in. The other thing that can actually cause bad breath is cavities in your wisdoms, because most people don't reach the wisdom when they are brushing very well, or even when the wisdom has not come out fully, what you call an impacted tooth last time, because you're not able to reach there. You're likely to get bad breath. The other issue that can actually lead to bad breath is the sinuses, infection of the sinuses, because when you're breathing, actually, you breathe through the nose. So if you have an infection of that, you may get that. The other one is just to do with your general, maybe you have problems with your stomach or in the GIT, you may get bad breath. The other one is just psychological. That one that you may just feel, I think I have bad breath. But your friends have not appreciated that, but you feel like you have bad breath. So it's actually psychological. So those are the things that we look at that can actually cause bad breath.
Okay.
Yes.
Okay. I'm not liking the fact that our time is running out. There's a story about antibiotics and giving a lot of antibiotics to your child that might cause a problem with their teeth. Is that right? Is it just a story?
That one is not. Honestly, it's not in our literature.
Okay.
When we are looking at the causes of tooth decay, there are factors.
Okay.
The first one is to do with your hygiene, how you're taking care of your teeth. The second one is to look at you as a person. As I said, there are people who are likely to get cavities, others are not likely to get cavities. The other one is like what we call the morphology of your teeth. how your teeth are positioned, because some teeth, if you find that your teeth are not well aligned, you may not be able to brush very well, so you might be likely to get cavities. The other one is the issue of time, how long you've actually given that food in your mouth to stay to get a cavity, because if I brush frequently, I don't give that tooth time to actually decay and give me a cavity. So the issue of antibiotics, which I'm actually seeing with most parents, we usually don't agree
Haiko
with
kwa
that.
kitabu
Haiko
yenyewe.
kwa kitabu.
Kuna mtu anasema, like we have so many questions. Irene from Ongatarungai, I have lost 4 teeth. They just fell off, but the roots are still deep in the gums. What is the process of removing them, or should they just remain there?
They fell off. The teeth fell off.
I'm assuming they fell off, but the roots are still deep in the gums. Is that possible?
I think it's just decay that
Oh.
progressed until that the tooth, once decay starts, it's the upper part of the tooth first, then what remains is the roots.
Okay.
Now we usually remove the roots.
Okay. You need to have them removed.
Yes, unless you're going to consider what we call implants. The root can just remain there as a way of what we call bone preservation, because once you're putting an implant, you need bone. So if you're going to consider that, then the root can just stay for a while, although we can also treat the root so that it's not infected.
Okay.
But ideally, roots should get out of the mouth because they are dead and they can attract bacteria.
Okay.
Yeah.
Dr. Mwende, I have a partially done root canal. Please, Mikali, ask her how much for root canals.
Root canals will range really on the because this one is partially done. So it ranges. You may get from as low as 15,000. It can even go up to 30,000, 40,000. It will depend on the condition of the tooth.
So you need to go see
And
a
it has
doctor.
to be finished because he's saying it's partially done.
Yes.
It is dangerous when it's partially done because it means the roots are open and they need to be closed. If they stay open for long, you will get an infection on that tooth.
Okay.
Yes.
Okay. Hi, Mikali, looking fabulous today. Thank you. I have really bad upper 4 front teeth. I have visited 3 dentists so far. They do the feeling, but the cavities keep coming back. The last dental visit left me with cracked teeth and half the feeling came out. I fear so much as what is left of my original tooth is now very thin. Mikali, I no longer smile even when I'm taking pictures. Please, Daktari, help me bring my smile back.
What I would tell that patient is to visit a trained dentist.
Okay.
Because you realize that the market out there is not.
Oh my God. I think, how can they, tuendeni kwa Dr. Mwende basi itabidi. Because you can see this is not how it's supposed to be.
Yeah, that's not how it's
A feeling shouldn't just be coming out.
all the time.
And now they've given you a cracked teeth.
So you really need to visit a specialized dentist. You can reach me via 0765 000 006. I think that's what I can tell that patient for sure. Yes.
There's hope for that tooth to
There's
be.
still hope,
There's
but
still
you need
hope.
to visit someone who
ASAP.
actually, yes.
Okay.
Yeah.
How much for, good morning, Mikali. Ask Daktari, how much do they install braces for?
Braces, again, it depends on the condition. There are some cases that are a bit simpler, others are complex, but the lowest we take is 150,000. Your case can go even up to 300, 400, depending on what you're actually treating. Yes.
Okay.
Yeah.
Hi, Mikali. My kid is 1 year, 7 months, and she has only 2 teeth. What could be the problem? 1 year, 7 months.
We said that could be an issue of delayed eruption.
Yes.
But we said once you've reached the age of 1 year, 6 months, and you've not seen any teeth, you should get worried. But now it's 1 year, 7 months, and there are already teeth that are coming out, which is okay. So what we normally do, we've said there are kids who will get delayed eruptions. And delayed eruptions does not mean that there is anything wrong. Unless you've actually seen that there are other milestones that are not happening on time, what you call delayed milestones. Maybe your child has delays in speech, in walking, and all that. You should not be worried. So once you've seen 2 teeth, The other thing that you can do is visit the dentist. They'll just take an x-ray for the full mouth to confirm that actually the other teeth are coming up. Because at that age, you will be able to see from the x-ray already the teeth that are forming and they are coming up. So I wouldn't really be worried about delayed eruptions, because most of the times they'll just come out.
Eventually they
Yes,
will.
they will come out.
Dr. our time is up. Imagine, just like that. I just feel like we never get enough time to just get through all the questions.
Okay.
But you do a good job in helping us. Please share with us clinic iko wapi and your number once again.
Okay, so right now I'm working with Equity Afya. We have clinics in Ruiru, we have in Eastern Bypass, we have in Juja, we have another one that is coming up, and very soon I'll have my own private practice along Thika Road. So yeah, we'll be able to share the numbers. But meanwhile, you can get me via 0765 000 006.
Okay.
Yes. Yeah.
Asante sana, Daktari.
Thank you so much.
We're going to take a very short commercial break, but please remember to share with us. It's the end of June. This is the last day of June. What has been your highlight so far during this month, and what are you aspiring for the next couple of months till the end of the year? 111 144 111. We'll be right back after this break.